first big differences between the Pico and the Avelle for you guys if you ever need a dressing. The kit, the pump itself is packaged alone. So it's like so, and in the kit is the pump, the tubing, and the batteries. This pump, rather unlike the Pico, actually lasts for 30 days rather than 7. So if you do have a patient that has a dehiscence, if you have a revision surgery in orthopedics, if they have a wound, any of those things is going to allow you more time with the product, okay? You'll notice there are 6 batteries here. You only need 3, but again, because it's a 30-day pump, you may go through your batteries in 14 days, and that gives you an option for additional ones. They are lithium, so if you need extra batteries, just know it's a AA lithium battery, okay? All right, so let's talk about why you're looking at this product as well. Another big thing with this, besides the fact that the pump lasts for 30 days, the tubing is Luer lock compatible. Why does that matter? Some of the surgeons are actually using Y connectors so that they can actually hook 2 dressings up to 1 pump. Plastic surgery for breast reconstruction, orthopedics for bilateral surgeries, all kinds of things. So that was a big plus. So from a cost savings perspective, they can use 1 pump and 2 dressings instead of 2 pumps and 2 dressings. Okay? So to use this, all you need to know is 1 1000, 2 1000, 3 1000 turns it on. Did you hear that little buzz at the beginning? That's just to kind of get the dressing to actually flatten. What you are doing is you're creating negative pressure, and basically negative pressure was created by a guy that said, you know, wall suction's an amazing thing. When I put that in those big bellies, I start pulling all that tissue together, and so that's how it came about. So its purpose in incision management is twofold. If you have drainage, it's going to help manage that, but it's also going to help prevent seroma and hematoma cases as well. And so when you start looking at your patients, you say, okay, we want to look at patients that are low risk, medium risk, high risk. So this patient was considered high risk, and that's why they opted for this. The next thing that makes this dressing a plus is the dressing itself. This is Aquacel that's here in the dressing. And Aquacel, when it comes in contact with wound fluid, turns to a gel. It's a hydrofiber, and the hydrofiber will hold 25 times its weight in fluid, and it will also pull that up, lock it in, and not re-release it. So it prevents maceration, and it also is very soothing on removal. We actually have a pain claim for removal, so it's not sticking to incision lines, very comfortable to wear. So when they put the dressing on, it is a silicone base on around the dressing, and then it has the strips that you can put on, the clear strips. What you're seeing right here, though, is a Duoderm strip that I put on. Those are great if you have a place like, for instance, right in that groin area where you get a lot more sweating and things like that. It's hard to get things to stick. If you aren't aware, Duoderm was actually created as a dental device to hold dentures in. So it's very good for sticking to those wet, sweaty areas, okay? And God bless us, every one of us that have had a baby knows about sweating. So know that works, okay? So the second thing, beside the little, we've got the green flash right now, that's telling us that we're good to go, everything's working. The next one is that little exclamation point, and that is for micro leaks. So if I had a little bit of a leak on this, it would tell me that. And you have a couple of options. One is to make sure you have a good seal the whole way around. So I always tell folks, palpate that and make sure it's in place. Another one is to use skin prep Mine happens to be the Sensicare Sting Free, but you can use really any skin prep on it. And just put it on the outside. What that does is it'll seal if you have a little pinhole or anything like that. You can always use a piece of Tegaderm over it if need be, just to seal it. But here's what I always tell folks. If you've done those couple things and you're now messing with it for 10 minutes or 15 minutes, you're better off to just change the dressing, because you're just gonna be spending a lot of time, you know, chasing your tail. So that's my recommendation. If you have a really horrible seal, what it will sound like is that, okay? And that happens, I find if you have a big leak, like it's flapped open, or knees are one of the ones that we always have challenges with. If someone stands up and they have a little bit of a gap in the dressing, meaning that they, you know, when they're laying flat, the dressing's flat, but now it pooches a little bit. Again, just palpate that down, because sometimes it's just a little pocket in the dressing, and this is trying to get that negative pressure again and seal it down to the skin. So palpate first, and if that doesn't work, then look for a leak. Last one is the battery. I mentioned that the battery should last about 14 days. If I come into a hospital and they say, huh, it's day 3 and my batteries are dead, they had a leak. So it's important that if your batteries are going fast, then you know that something's going on with your dressing. Okay?
And that would be a yellow indicator light.
Yes, yellow indicator at that little battery picture right here.
So you can see the green flash is the indicator that it's functioning, and you would only see a yellow flash either at the exclamation point or the battery for the warnings.
Exactly, okay. Exactly. And anything yellow tells you you need to do something, okay? Now, what I've also brought in for all of you is a folder that looks like this, and it has information about the dressing. Here it has a call number, an 800 number that you can call just to ask any questions you might have about the Avelle. The little blue card is mine. I'm Annette, so call me if you need me anytime. And this is the tear sheet that you give to your patients. And on this tear sheet, it also has instructions for showering and for if the dressing has any drainage on it. If it's just a little bit, that's fine. If you've got it coming into that little pad part of the dressing, then you might need to change it, or if it's loose or leaking. One thing to think about with these dressings, if you're used to ever using negative pressure, you're probably used to the old canister idea. So think of the dressing as the canister. So everything is to go into the dressing, not into the pump itself. This is a pump, not a canister, okay? As far as showering, again, instructions are here for your patients, but all they really need to do is turn off the device, disconnect it at the tubing spot, and go right in the shower. They don't need to put a tape or anything over it. It's a one-way valve, so nothing's going to go back up into the tubing, so that's safe. And it is waterproof, the dressing, so they can wear it in the shower, which makes everybody happy. The 800 number I mentioned for you is also available for them. It's on the back of the sheet, so I would, make sure they know that. If they have a question, they can call, okay? The other things that are in this little handy dandy piece is information about the actual Avelle and the sizes of the dressings. Remember I said that the dressings are packed separately? So if you ever need an extra dressing, instead of you having to take a whole kit and tear it apart to get a dressing, you can just get one dressing out of the storage, okay? Also, there is a quick reference guide here, and that quick reference guide also has a QR code, so you can hold your phone up to that and it'll show you the in-service of any troubleshooting you might need to do. And then the second one is the application guide. Has the same thing. If you're putting a dressing on, you can do that. One of the questions that we talked about yesterday is who would do that dressing change? I know in orthopedics right now, it's usually the residents doing them. So I would guess that's going to be the case here, but that would be, you know, a determination by your clinical staff, okay? Other things in here, some folks have asked me, you know, what's the absorption of the Avelle? And this speaks to that. One of the great things beyond just absorption is what I talked about. Even when there's that pressure put on the dressing, it keeps that fluid in so you don't macerate the tissue. Okay, I think, oh, let's talk about taking the dressing down. Remember I showed you the Duoderm that you can use to take your dressing off, or keep your dressing on, I should say, sorry about that. Looking for a little dressing so I can stick it to somebody. That's not it, this is it, okay. So, one of the things that you can do...
Can I help you? Can I help you?
Can I use
I'll be
your
there
arm?
in just a minute. Go to the underside. There you go.
Use a one.
And just an FYI, as she's doing this, that folder she showed us is going to be in the mailbox outside my office, just for the trial. And then should we go with this product, it is going to be at a central location, and then we'll have the supplies for you as a par in the storage room.
Okay, so this is sting-free adhesive releaser. And basically, you don't have to just use it on our products. Think about any time you have fragile skin and you're concerned that you could create a skin tear, you know, IVs, you name it. So when you use the product, use it kind of and let gravity do its job. So I'm going to tilt your arm a little bit, and I'm going to put this here. And what happens is this actually will start to remove the dressing without you having to pull skin. I'm using a lot because I'm hurrying, but essentially it starts to lift it all by itself. Okay, and then once it's done doing that, it actually doesn't leave a residue on the skin, so you can put a dressing down right after that.
And I'm assuming this product is safe because if you're spraying that, it's okay to go into the
into wounds. Actually, this was created for wound care.
Okay.
And so they put it directly into wounds, so it is inert.
Okay.
It is a silicone base, and so it is safe. And then in about 30 seconds, this is sticky again.
Oh.
So we use it for ostomy patients, so they would be able to put an appliance on, and if it wasn't seated right, they could take it off and put it right back on. Okay, so that is called Senticare adhesive releaser.
So is that just an additional product we would have to order? Because I know we don't have that stocked. But you did mention we could use regular saline to help with that as well, right?
Yes. Oh, saline is more for, let's just say, okay, so let's say you had this on and it just so happened that this patient had a little bit of a leak. So every now and then you would hear that thing, you know, fired up, making that little beep beep noise to kind of manage it. What may happen is that may dry out the dressing a little more than is normal, because it's fighting, because it's getting air under there. So in those cases, if you do find that when it's time to take the dressing down that you've got anything sticking, what you can do is just lift your adhesive and then put a little bit of saline in there, and that'll turn that dressing to a gel, and then it comes off very easily.
Perfect.
Yes. This is more for adhesive. The saline would be more for the dressing itself. Okay? Okay, that's everything.